All right, next I'm going to demonstrate how to spike a bag with equipment that has already been used in the lab. So in the previous video, I showed you how to spike an IV bag with brand new equipment. But since we reuse a lot of the equipment in our Broward College labs, I want to demonstrate how to reuse this equipment. So you can see that this bag has already been spiked before. So if I take this cap off, if I go like this, you can kind of see how the fluid is going to come out as I squeeze it, because that membrane has already been punctured from a previous spike. So we recap it with this to kind of simulate like as if it's a brand new bag. We also try to keep these bags in a sterile container to simulate like you opening it up. With the drip sets, we reuse these caps as much as possible to simulate another brand new IV drip set. You can see that this line is going to be exactly how we found it if we open up a brand new piece of equipment with the IV drips. So we kind of ravel it up as I'm showing you. We place it back into the container itself with the sterile caps, both on the distal and proximal ends. Now, when we spike this, since this membrane has already been punctured, we can't hang it up on the IV pull as I showed you with a brand new bag. So what we have to do is do it on the table itself right here. So it's the same procedure. We're gonna open up the correct IV tubing. In this example, I'm using a micro drip set, which is a 60 drops per ml solution set. Move it up to the top, and I'm gonna shut it down. Once I shut that down, I'm gonna take the sterile cap off here, and you can see that the prongs of the IV bag are going up this way. You don't wanna keep them down this way because the medication access port, we wanna keep as sterile as possible, but then also we can connect our bag easier right there. So sterile cap off here. Same procedure. Once you puncture that membrane again, then you can go ahead and put your bag up right here. So similar to the previous video, we're gonna squeeze the drip chamber. We want it about 2/3 of the way, which is about right there. And you can see I have some bubbles again. So I'm gonna gently just tap the sides of the drip chamber, get rid of any excess bubbles I possibly can. Now with the brand new bag, you can see that it's not really flowing like it did with the brand new bag. It's because there's residual pressure, residual water that's inside this IV tubing. And what happens is you may have to give it just a quick little squeeze. So if I open it back up, just give it a quick little squeeze, and now you can see that it's flowing. And then I could go ahead and prime my line as if it's a brand new line with the IV tubing and the IV bag. So it's very normal to see some fluid come out of this until it's completely primed, as you see right there.